So, I am Dr. Sushmita Roy Chowdhary, consultant pulmonologist, Apollo Gleneagles Hospital, Kolkata. So, see, sleep disordered breathing actually encompasses quite a significant number of diseases, amidst which the most common sleep disordered breathing is obstructive sleep apnea, which has been present for time immemorial, and you would have heard of the Pickwickian syndrome in David Copperfield's stories of a really obese gentleman who kept sleeping off or nodding off, and that has been happening, and snorers have been made fun of, but it is just not a disease of snoring, it is much more than that, and the trends largely went unrecognized in a country like ours, which has many more things to worry about, and for a very long time this was considered to be a disease of lifestyle, which to a certain extent it is, but obstructive sleep apnea can have significant amount of effect on a patient's body, and also chronic morbidity, and also lead to lifestyle hampering, also lead to significant amount of other diseases and complications. So, the most common challenge in our country is that we have other diseases that people have to think about, and it is thought that a disease of snoring can be neglected, or it can be put on the back burner, whereas it can cause a lot of problems, and as a result of that, when it starts straight away from training a doctor, sleep medicine is not part of the integral curriculum. When you train as a respiratory physician, it is a part of it, but it is thought to be as a part which can be not given as much importance as the other things are, and only people who are interested in sleep medicine then go ahead and train themselves in other countries with short courses, etc. So, amidst doctors, especially doctors who are physicians and form the backbone of this country, who are general practitioners, amidst them the knowledge and the thought of catching a sleep apneic patient early still is much more desirable. And again, as I said, it is considered to be a disease of snoring amidst laymen and other population. So, they would rather spend their disease being diagnosed as for an infection rather than sleep apnea. So, I think the way forward definitely is, first of all, creating awareness as you are. Secondly, incorporating it into regular curriculum of medical school, and also making people who have benefited from this treatment show it more and more, so that other people who are silent sufferers get to know that it is a disease just more than snoring. So, that's again a good question, because sleep study basically initially meant getting admitted into hospital, staying for the night, and getting a whole load of wires connected to you, and then people who were doing it, they weren't as well trained before. The machines were significantly bigger. Now with time there are sleep studies where you're suspecting sleep apnea alone. You can actually do it in your own bedroom, in your own surroundings where you're comfortable sleeping, and the machines are way smaller. The labs are becoming more compact. So that way I think things have changed. The study per se, investigation per se, has not changed much, and a good sleep test is absolutely essential in diagnosing sleep apnea. Otherwise you end up diagnosing over or under for these patients. So, sleep labs previously were just one room in a hospital or a nursing home setting where people would come. They might not be comfortable, and they would come one night, and then if they were diagnosed with sleep apnea, come back another night for seeing whether they would benefit from the treatment given for it. But now what can be done is a split night study with much more compact devices, where half the night you can test for the disease, and if that condition is found, then for the rest of the night you can also test with the treatment with the CPAP machine to see whether they benefit from it or not. So, it can be done the same night. Also, compact home monitoring systems are also available, which are limited sleep study machines. They are not as long as the other ones, but if you are only suspecting sleep apnea, then that is something that can be done for people who are apprehensive to get the tests done in hospital.